Can you avoid surgery for a rotator cuff tear? This is a really common question that people ask me, and a lot of people, especially over the age of 60, will start to have some issues with the rotator cuff. It's essentially like a group of 4 muscles that helps us stabilize the shoulder. This is actually a surprisingly weak attachment system here for as much as we use our shoulders. And we got to keep in mind that all these tendon attachments from like the supraspinatus, infraspinatus, and subscapularis muscles all are kind of fragile and very overused. A lot of times this is a matter of determining whether this is just a partial tear or a full thickness tear. And full thickness tears, you absolutely need to see an orthopedic surgeon and probably have surgery. Anything less than that, there is some wiggle room. I work with this a lot with acupuncture, and I generally recommend more conservative treatments for this if possible. And like I said, the tendon attachments don't have great vascularity, so there's not a lot of blood flow. And what acupuncture really does is help to direct blood flow to those specific spots. This initiates that healing mechanism so that those partial tears can heal. If you end up getting surgery for your rotator cuff, then acupuncture is a great rehab modality to use for this as well. So to sum it up, yes, more information is always good. I do recommend seeing an orthopedic surgeon just to get their opinion. And ideally, you want to start conservative with your treatment. So start with acupuncture, start with cupping, start with dry needling, things like this. This is all going to be very helpful to your partial tears. And then last step would be, of course, if you do need to get surgery, come see an acupuncturist afterwards. We can really help speed up your recovery and get you back to full function.